He thought, if it gets better when I rest, it can't be anything serious. But what he didn't realize was that his body was giving him subtle warning signs. Signs that are often missed. Signs that many seniors overlook until the problem becomes more advanced. Because in some cases, what feels like simple back pain may actually be something else entirely. Something that develops quietly. Something that doesn't always cause severe pain at first. Before we go further, if you find this kind of content helpful, take a moment to subscribe. This channel is here to give you simple, practical health information to help you stay informed and make better decisions as you age. And I'd also like to hear from you. Let me know in the comments where you're watching from. My name is Dr. Amba Carter, and in today's video, we're going to talk about the signs that your backache may not be what it seems. These are signs that are often ignored, misunderstood, or dismissed as part of normal aging. But recognizing them early can make a meaningful difference. Now, let's go through the signs, starting with one of the most common and one that many people don't think twice about. Sudden back pain without injury. One of the most commonly overlooked signs of a possible spine fracture is sudden back pain that appears without any clear cause. There's no fall, no heavy lifting, no obvious strain, and yet the pain is there. This is often where the confusion begins, because when people think of fractures, they imagine a serious accident, something dramatic that clearly explains the injury. But in many older adults, especially after the age of 60, that's not always how it happens. In some cases, the bones of the spine become weaker over time. This can make them more vulnerable to small stresses that wouldn't normally cause a problem. Even simple, everyday movements, like bending, reaching, or standing up, can sometimes trigger a small fracture in the spine. And when that happens, the first sign is often sudden back pain. Now, this pain may feel sharp at first, or it may feel like a deep ache in the middle or lower back. It can come on quickly and without warning. And because there's no obvious injury, many people assume it's just a normal part of aging. They may think they slept in the wrong position, or that they simply overdid it the day before. But here's what's important to understand. Pain that appears suddenly without a clear reason deserves attention, especially when it feels different from your usual aches and discomforts. Another important point is how the pain behaves. It may worsen with movement, or become more noticeable when you try to stand or walk. And in some cases, it may persist longer than expected. Now, many people try to manage it at home. They rest, they apply heat, they wait for it to improve. And while mild back pain can often resolve on its own, a fracture may not. The key takeaway here is this. If you experience sudden back pain without a clear cause, especially if it feels unusual or persistent, it should not be ignored. Because in some cases, it may be a sign that the spine has been affected in a way that requires attention. Loss of height. Another subtle but important sign that is often overlooked is a gradual loss of height. Now, this doesn't usually happen overnight. It's something that develops slowly over time. You may not notice it right away. In fact, it's often first noticed by someone else. A family member might comment that you seem a bit shorter, or you may find that clothes don't fit the same way they used to. Perhaps you notice that you're not reaching the same height on a wall marker or measuring scale. At first, it may not seem like a concern. After all, many people assume that losing a little height is just part of getting older. And to some extent, that can be true. But when the change is more noticeable or happens more quickly, it may be linked to changes in the spine. The bones in the spine, known as vertebrae, help support your posture and maintain your height. When these bones weaken, they can begin to compress. This compression can cause the spine to shorten slightly, and over time, that can lead to a measurable loss of height. Now, this is often associated with small fractures in the spine that may not cause severe pain. Because of that, they can go unnoticed. But even without significant discomfort, these changes can affect posture, balance, and overall mobility. Another important point is progression. If height loss continues over time, it may indicate ongoing changes in the spine, and that's something that should be evaluated. The key takeaway here is this. If you notice that you are gradually becoming shorter, even by a small amount, it's worth paying attention, because your body may be signaling changes in the structure of your spine, and recognizing those changes early can help you better understand what's happening. Stooped posture. Another sign that often develops gradually is a change in posture, specifically a forward-leaning or stooped position. This is sometimes described as a slight hunch or rounding of the upper back. At first, the change may be subtle. You may not notice it in the mirror, but over time, it can become more apparent. Others may notice that you are standing differently, or that your shoulders appear more rounded than before. Now, posture can change for many reasons. Muscle weakness, joint stiffness, and daily habits can all play a role. But in some cases, a stooped posture may be related to changes in the spine itself. When the vertebrae in the upper or middle back weaken, they can begin to compress. This can cause the spine to curve forward slightly, and over time, that can lead to a noticeable change in posture. This type of change is not just cosmetic. It can affect how you move, how you balance, and even how you breathe. You may find it harder to stand up straight, or you may feel more comfortable leaning forward slightly. Now, because this change happens gradually, many people don't see it as a warning sign. They assume it's simply part of aging. But when posture changes noticeably, it may be worth looking a little closer. Another important point is how posture affects daily life. A forward-leaning position can place additional strain on muscles and joints. It can also increase the risk of falls, especially if balance is affected. The key takeaway here is this: if you notice a gradual change in your posture, especially a forward bend or rounding of the back, it should not be ignored, because it may be a sign that the structure of the spine is changing. And understanding that change early can help you take the right steps moving forward. Pain when standing or walking. Another important sign to watch for is back pain that becomes more noticeable when you are standing or walking. At first, you may feel fine when sitting or resting, but as soon as you stand up or begin to move around, the discomfort increases. This pattern is significant because it suggests that the spine is under stress when it is supporting your body weight. Now, in everyday life, it's normal to feel some level of fatigue or discomfort after long periods of standing or walking. But this type of pain is different. It can appear quickly, it may feel sharper, and it may limit how long you're able to stay active. You might find yourself needing to sit down more often, or avoiding certain activities altogether. Now, why does this happen? When the bones of the spine are weakened or affected, they may not support weight as effectively. This can lead to increased pressure in certain areas, and that pressure can result in pain when you are upright. Another important point is how consistent the pattern is. If the pain reliably appears when standing or walking, and improves when you sit, that pattern is worth noting, because it provides a clue about what may be happening in the body. The key takeaway here is this: if your back pain becomes worse when you stand or walk and improves when you sit, it should not be ignored, because it may be a sign that your spine is under strain in a way that requires attention. Pain improves when lying down. The final sign, and one that often provides an important clue, is back pain that improves when you lie down. Now, this may seem like a relief. When the pain eases, it can feel like the problem is resolving. And because of that, many people assume it's nothing serious. But the pattern itself is important. When pain decreases in a lying position, it suggests that removing pressure from the spine is helping. In other words, the discomfort may be related to how the spine is handling weight and movement. When you are upright, standing or walking, your spine supports your body. This places pressure on the vertebrae. But when you lie down, that pressure is reduced. And if the pain improves significantly in that position, it may indicate that the spine is sensitive to load. Now, this doesn't mean that every case of back pain that improves with rest is serious. But when this pattern appears alongside other signs, such as sudden pain, posture changes, or loss of height, it becomes more meaningful. Another important point is how quickly the relief occurs. If lying down consistently brings noticeable improvement, it's worth paying attention to that pattern, because patterns often provide valuable insight into what the body is experiencing. The key takeaway here is this: if your back pain improves when you lie down, but returns when you stand or move, don't ignore that pattern, because your body may be signaling that the spine is under strain, and recognizing that early can help you better understand what's happening.